PRF. I'm just going to add him now. There we go. Hello, Anil. You should be... yeah, Anil's just joining now. Hello.
Good morning, Maddie. How are you?
I'm very well, thanks. How are you doing?
I'm doing good. Thank you for having me.
No, absolute pleasure. Thank you for joining us. I was just explaining to everyone who's joined the live that unfortunately we can't have Syed here today. So I will kind of join as a little host and we will pick your brains on everything to do with PRP versus PRF. And then we'll move on to threads treating the lower face. So I'm super excited. I can't wait to learn lots. Yeah, we don't.
I'm excited that you could join. I was excited to see you. I haven't seen you in months.
No, I know it's been a while. It's been a while. So yeah, good to little catch up.
Yeah. How's everything over there? How are you guys making out?
In the UK, we're slowly easing some restrictions. We had quite an intense lockdown. Obviously needed to be done, but we're hoping to get things moving slowly, but obviously in a really, really safe manner.
Wonderful.
It's been crazy for the whole world. You know, it's not anything we've seen before. So it's new for everyone, I think, to adjust to. What about for you in the States?
Well, I mean, I think we mirror what's going on over there, very similar to what you guys are seeing. And people are starting to get mobilized, and there's a bit of a divide in the country. Some people want to go back, some are more cautious, and it'll work its way through. But one thing is, aesthetics is picking up really quickly. People are waiting to come into clinics. They can't wait to get their treatments. There's a few extra steps, so it's a little bit slower. But I just saw like Dr. Lip is on here, Stepan that we see in our conferences. All those people, they keep me informed. He's been telling me what's happening in Germany, so I know what's going on. And I see a lot of people that we work with internationally. So I've been in touch with so many people just to see, what are you seeing? And a lot of it's similar.
Yeah, that's true. That's true.
Yeah.
But it is fascinating to see how each country has reacted and, what the lockdown has been like for them and just, varying around the world.
Yeah.
It's interesting to see.
I think people are ready to take care of their face again. They've done all the at-home skincare.
Yeah,
Everyone's
I can't wait personally to have, some treatments done. So I definitely relate.
There'll be a few extra steps when people come into the clinic, and we'll all adjust to it. And then we'll get a vaccine at some point, and we'll get more familiar with the pathophysiology of the virus. And then people get a little more comfortable. But I think I was wondering too, because I think we're going to talk a little bit about threads, and we're talking a little bit about platelet-rich fibrin, and you said something interesting too, that maybe a lot of people in the UK don't use platelet-rich fibrin or blood products. Is that true?
We have a lot of PRP, but PRF really not so much in the UK. So this is why it's fascinating to have you, because I've seen from your YouTube and everything that you are an expert on this. So your knowledge and insight is very much appreciated for us over the pond.
Well, I've used it for a long time. I'm an expert in that sense, and I study it. But a lot of it too, I learned in France. And from the dentists. The dentists use a lot of platelet-rich fibrin, and we kind of modified it for aesthetics because the dentists allow it to clot, and that was the biggest thing to overcome. And I just, before getting on here, had a message from someone who just started using it actually 2 days ago. And because a lot of people were educating over this time when we were out, purchased some new things, and they said, we only have a short time to work with it. You have about 20 minutes to work with PRF, but people have to adjust.
Yeah.
Even now, with coming back, we want to get people in clinics and out as quickly as possible. So, but PRF, I used to do a lot of PRP myself, and then I started doing platelet-rich fibrin, but I was interested to hear that about the UK and PRF.
Yeah, I know we definitely do have it, but it's just not a common aesthetic procedure.
Because you're so up on everything. Like people from the UK, when they ask me on YouTube, they're so forward thinking, and they're using different products, and
love to experiment.
And the people seem willing too. Like people are like, I don't care what you do, just make me, so
yeah.
I love hearing from I think I hear a lot of people from London, a lot of people in the city, I suppose. But so PRF, I think the main difference is for people who are using PRP now is the time, it's pure. And that's the beauty of it. And I think in the UK, that's one of the things that people would love, similar to the west coast of the United States and in Canada. People like fully organic, or they like the fact there's no additives with platelet-rich fibrin. It's simply your blood spun. And I think the two most important things to think about why it's spun differently is it's a slow speed, and the angle of the tubes are important, and they have to be so perfectly smooth inside, because if the blood sees anything irregular on the tube, it clots. Okay. And that means when they go with anesthetics, we need a liquid. We need to be able to pull a liquid out and inject it in the face. And why PRP stays in a liquid is because a lot of times there's heparin or sodium citrate, which is a blood thinner. But the idea with platelet-rich fibrin is we don't want to have a blood thinner in there because we want it all pure. And the idea is the blood thinner, we don't know what it does to the growth factors. And ultimately, to get a result, and the home run, what I do the most of, are under eyes, because it's a driver to practices. In the UK, you're lucky. You're like me in Canada. You don't get a lot of sun exposure there, you see. But you come to Southern America, Central America, people get a lot of sun exposure. If they have light colored skin, then the under eye is a real driver people come in for. And platelet-rich fibrin, what it does, it tightens the skin, it brightens it, and it helps to plump the fat a little bit. So I think those are some of the things the people to think about. And when you think about PRP, one of the things also, a lot of the Europeans brought this to my attention many years ago with PRP. When you spin it, there's a little plug in there that's made of a proprietary material like a plastic or sometimes a biomaterial, but it separates the red cells from the good stuff, meaning what we want to inject. And the question is, what is that? And are there little particles? And there's evidence that some of that may be injected. So that's an impurity that PRF doesn't have. So it's a little more technical, but it's 100% pure. So people like it.
Yeah, no, that's very, very interesting to know. And I think with time, because it kind of started with PRP, then I see PRF coming more and more. But celebrity culture has a huge impact on what treatments are popular. So
you have that too, with celebrities determine a lot now.
Huge,
I need to come. I haven't been to London in 2 years. I have to come over.
You need to come back. It's honestly a place to be.
Now, you lost two of your celebrities. They were going to come to Canada and they went to the States, I think. Didn't you lose some of the royal family to us?
I know. This is a touchy subject.
I don't follow it, other than I'm Canadian. Yeah. And when I saw they were coming, I follow the Canadian news a little bit. Yeah. But when you say celebrities, tell me, are they local UK celebrities, or do you follow more American culture, or what do you see people wanting?
Both. This is mainly actually using Instagram, so a platform that we're on now. You see the hashtag of the PRP facial or the vampire facial, and it was really, really popular at one point, where people would take selfies with, the kind of the red blood face and everything like that. I think it was actually Kim Kardashian, so American celebrity, that first popularized it. It does have an impact, I think, on kind of treatment trends.
Yes.
And because she said PRP, I think that's probably why we had the PRP storm.
Yes, and it's true. And I think it was the first one because it was the easiest to make. Mm-hmm. The next generation is the PRF. And what's driving it is results. When people switch over to PRF,
they won't go back.
They see, if you take a clinic, and I say to people buy $200,000 laser devices for their clinic, right? But a PRF device might cost a clinic such a fraction of that. It's in the thousands, not in the tens of thousands. And they try both. So I just say, get a PRF, start spinning PRF, and compare it to your PRP. You can have both. And you'll see the clinic switch over to PRF as they get comfortable. But it's the results that drive it, because their PRF patients are typically happier than the PRP. So that's what we see over here in people who try both. But I always tell people, that people are scared to change, you know, and I'm always fearful myself every day. Try and get the same coffee. I try and keep my regimen, and people don't want to change. But you can have both, so people don't have to dive in. I think the other thing about those things, they're so versatile. You mentioned doing a microneedle facial. You can inject it. I inject it with Sculptra, PLLA. I inject it alone under the eye. Hair growth, like when people in the lips. I know the UK lip filler's big. You can't tell me
Yeah.
otherwise because I see. I'm a YouTuber, not an Instagrammer, as you'd probably know. But on YouTube, I follow some YouTube influencers, injectors in the UK. They do a wonderful job on YouTube. And I see a lot of lip fillers, but you can put PRF in the lip to give color, to help boost the filler, and you can do it in the brow. I mentioned the under eye, but you see, when you have it in your hand, you can inject for the under eye to tighten the skin and brighten it, plump a little bit. You've already spun and drawn the blood, and the men, you know, the men don't like having the blood draw, so you better do everything with that blood while you have it.
It
And
makes
you,
sense.
women are fine here. And if you miss a blood draw on a woman, they're like, "Oh, I got another arm. Don't you worry." The guy's already passed out, you know. So, but when you have the blood, you know, when you spin down, you can put it in the brow for hair growth. So it's so versatile in a practice. There's so much you can do. And
Yeah, that's
then,
fantastic. Actually, I didn't think about how versatile it was. You know, with the hair growth and then also with the skin
yeah,
benefits. Too. Just
you can
like a
put it
wonder.
under the eye, in the lip, in the face for lines, and then in the brow for hair, all in one sitting. And that's what makes it popular. Now, this is one thing I wondered whether you're seeing there. One of the biggest topics we get here is the cat eye. Have you heard or seen with PDO threads lifting the eye so that the angle is up like that?
I have. I was actually just about to ask you, as soon as we kind of done our PRP and PRF, I was going to be like, the threads, the cat eye, this is all I'm seeing on the Instagram. It's just like all of the lifting. I have to say, some fantastic results.
Do you like the look? You know, a lot of plastic surgeons will say, you know, these women are coming in all jacked up and cat-eyed up, and it's unnatural and everything. And we're always playing this balance of natural versus creating it. It's almost like there's a tug of war. And my take on it is, hey, we have the ability. I think people shouldn't look bizarre, but you have the ability to change some different angles, and we need to embrace it a little bit. But do you like it all the time, or do you feel some people get too jacked up? I wonder what your viewers think too.
So my personal opinion with it is, I think you can go too far, like with any procedure. But I do like being a bit creative and maybe having a slightly bolder look. But if you're going to do that, I think only with one feature. So maybe have slightly bolder lips and then have a more natural eye area. Or if you're going to have more kind of, you know, bold eyes, then have a more natural lip. I think it's all about harmony and not having everything crazy or just like everything downplayed.
That's a really good point too. And someone commented on here two things. One says, "Hey, it's not permanent," and that's a good point. Is that these things go over time, and it might leave you with a nice subtle lift as the collagen stays and the thread goes, and it's not permanent. And someone else had a question: do I use cannula with PRF under the eye? And that was a great one because
Yeah.
because of the clotting. Anything I inject, I always consider that, yes, it could cause an embolus or an arterial, anything from obviously fillers to PRF, because also anything we inject that has a molecular size of any substance can embolize. So yes, I use a cannula, and yes, someone's there saying here it's a fad. I think everything's a little bit of a fad, and then we simmer down to what's a normalcy. You know what I mean? Like being way jacked up might be a fad. That's true. BioLite, you said that. But yeah, I like it, and I think using barb threads. Now I see a lot of lip fillers in the UK. You have PRP. I know there's a lot of interest in threads, and I get a lot of questions on YouTube on threads. Are they trending, or you see them trending?
I think so, yes. It's again in the States, it's just the versatility of what you can do, you know, like this
True.
whole cat eye thing, and then lifting the lower face.
Mm-hmm.
The results with that are fantastic. And also just there's like no downtime. With the traditional facelift, you have an enormous amount of downtime. But with threads, I think just how quick it is, how affordable it is in comparison to a facelift. This is
Yeah.
what makes it very, very popular.
Yeah. And then when I go to a conference or I'm on here, I know everyone wants, if there's different rooms, with different topics, the thread room always packs up, and the lip room, if it's lips or threads, it's going to be popular. And same with YouTube videos. If you put one up on threads or lips, it's popular. If you start talking skincare, the metrics go down a little bit. So people are embracing a little more, but I think we've evolved with threads, and I think the smooth threads are being used more, which I like. It's not all about the barb and the big lift. And people are understanding we're not trying to reproduce a facelift. I think that's the other thing, that when things first come out, like this person commented on a fad, people are like, well, instead of getting a facelift, I'll get a thread lift. And in many people, you can delay it, but it's a totally different procedure, and it's more minimally invasive. Doesn't replace surgery. And if you wanted a surgical facelift, you could get that and then still get threads, are still going to be probably appropriate to fine tune. So that's what's evolved here in America, is that shift towards understanding kind of how the Koreans use it and the Asians use them. And someone here's Dr. GMD saying, exactly, realistic expectations is the key. Yeah. And I think you tell me about what you get, but here we'll have clinics that will say, thread lift, $1,099 this week only. Go cancel your facelift, get a thread lift. And I'm like, that's what gives things a bad name and what we're trying to avoid. Do you see any of that kind of marketing over there? Do you get that?
We used to a bit, but I have to say it has clamped down enormously on kind of the whole advertising side of things, and not trying to really, really play on people's insecurities or whatever it is. So we have quite a good board in the UK, and also there is a notion to say the cheapest isn't always the best, and you need to have a proper, thorough consultation to see what suits you and what your specific needs are. So the whole flash sale side of things, I think, has decreased, which I think in general is a good thing.
Non-surgical options for a lip lift, someone's asking here. And I think that's a good one too. The lip lift is another trending one. The distance from the top of the lip to the nose, and people are real conscious about it, and they're, so non-surgical options, and I think the key is knowing that there is surgery and there's non-surgical, and certainly you mentioned it, the consult is the most important thing if we can get it, and that's what separates clinics. But filling the lip helps. Using neuromodulators, you have different ones, can help. And then paying attention to the philtrum column can help. And the other thing is the distance from the lower lip to the chin, because if that's longer or shorter, it affects the perception of this ergotrid in here. So we do, and we're seeing a lot of trend. This is another big trending procedure here. Of course, jawlines have been for a while, but the chin projection and chin fillers is just going to get started here. I think people do it. A lot of people do it. Don't get me wrong. But when you see things on Instagram or so on, a lot of times what we're seeing is the top 10% or the 10% of forward-thinking people. 90% of the country still doesn't do a lot of chin projection. And people think they want to get lip filler, but getting lip filler, you have to think about chin, nose, downturn of the mouth.
It's working in harmony, everything working in harmony. And what is so bizarre is that if you add some chin filler, it can change the way that your lips look, and you might not have even touched your lips, but it's just everything working together.
And you probably know, remember in Bangkok, we had that conference was just amazing there. We had a wonderful time, but a lot of the Asians there that we treated over the few days they wanted chin projection. They wanted a narrowing here to create that shape. And so different cultures.
The heart shapes was really, really in, elongating here.
Yeah. And so different cultures kind of almost bring things in, but a lot of times because maybe they're not on the forefront of social media in America, they don't have such an influence, they don't get credit for it. But really, they've been doing things sometimes years before we think of them, in America anyway. And then people bring it here and go, oh my, we invented this. And I'm
Yeah.
thinking, we were doing that 10 years ago overseas, you know. So it's an interesting what's bad. But we're seeing a lot more chin, a lot more people paying attention to the chin too.
Absolutely. I mean, I remember watching a program and it was talking about a Korean lip trend called the cherry lip.
Yes.
Round, which again, I think in the, you know, the Western world, we call it the heart-shaped lip.
Yes.
But same, cherry,
Yeah.
heart.
We love our tag names, right? We love our catchy names. Someone's asking here, do I like radio frequency? I love radio frequency. I like ultrasound too. Those are the two competing platforms, I think, for facial tightening. But I think the biggest thing that we hear, like if I put up radio frequency versus high frequency ultrasound in a video, a lot of people are talking about they lose their facial fat and they feel gaunt after and all these different things. And I think there's two things with that. I think one is people go get those procedures when they're seeing aging changes in the skin and face. And oftentimes what we're educating against is they come at, say, age 47, not 27 or 37. And at that time, there's so many changes taking place hormonally with bone, with fat, with skin. Within a year, they've had a lot of changes just naturally. So so they think, well, it must have been the treatment. But a lot of times, you have to separate out, I'm aging way more from 47 to 48 to 49 than 30. So starting radio frequency and ultrasound early and knowing the expectations. And then also with fat loss, again, it's the depth and the operator. To your point, it's the consult and the person doing the treatment. We can target fat, we can target skin, but the technician, the operator, whoever's doing the procedure needs to know how to use that device, and that it should be tunable. So it's not the cheaper devices. It's one size fits all, and you just heat the whole face. It's understanding that I might want fat gone here, but I don't want too much fat gone here, maybe, right? And I don't want to lose the fat in my forehead because I don't have any, and I need to keep it. You know what I mean? So when people say, do I like RF, it's not a blanket statement. It's tunable.
Okay.
What are your thoughts about the hyaluron pen for lip filler? I'm seeing a lot. So I've done
quite a few questions. We'll scroll up afterwards. Good engagement though. Thanks guys. Keep them coming.
It's better to, I mean, we love answering questions, but hyaluron pen, you can see, I've done 2 videos on the hyaluron pen and I've used it. And I've used different ones that were the 3,000, which would be expensive in America, the real top of the line pens. And then I've ordered the real cheapie just to see what you would get, what would come. You can watch videos to see all the details, but I would say maybe 3 points on the hyaluron pen. People who know how to use them can use them. They like them. I'm never threatened by it. If they like it and they're happy, that's great. What people consider, let's say 3, we'll go through 3. Number 1, the depth isn't controlled because you're using an air push to get it in. So a lot of times you get superficial filler, and then if it truly is cross-linked, this is the second point, what are we putting in? If it truly is cross-linked product, they'll have to come into a clinic to get it dissolved because it's too superficial and it won't go away quickly. So understanding the depth, understanding the product. And a lot of times for here in our country, they're ordering it off of online stores. I won't single one out, but there's some big ones. And the product that comes to them is unknown. So you really want an unknown product in your face. The third point, a lot of times it's non-cross-linked because it's a smaller molecule. It can go in. And what happens is the swelling and everything and the look might last a week or 2 and it's gone. So if people are happy with them, they've used them, it's great. 90% of the people that give me feedback on my YouTube from the videos, because that's why I love it. Everyone from all around the world is telling me what they think. And then I luck good and bad. I mean, on Instagram, people will send me pictures. Here's my side effect, what I do. So I learn. But a lot of the people that send me side effects, it doesn't look good. It doesn't last. And those are some of the problems. But I have nothing against the hyaluron pen, but it has some issues and obstacles to overcome. Maybe we'll get there where they'll be predictable. They'll have a better product to put in. But everyone wants to do things at home and not come to the clinic. And how can you blame them? I'd rather be sitting here not have to come to go get my stuff done too. So maybe we'll get there.
Well, sometimes it's quite nice, you know, if you have the whole experience and you're going to the clinic, it's like a full-on treat for yourself, and you're in that environment, and you know, so
yeah, and you're excited, and you're hearing about your practitioners. Hey, what can we create? What are you seeing aging in my face? 20 years ago, people were scared to say, look at my face. What should I do? What do you recommend? Because there was a lot of, it wasn't talked about. Like today, especially the youth, they walk in, they go, Doc, I want to look like this. I want to step up my look. I'm an Instagrammer. What? No one cares. They're like, they want you to be as honest as you can. So it's real refreshing for us, for the old timers, to do it. How do you do PRP mix with neuromodulators for areas like Prp? I don't mix the two in a syringe because as you get dilution, you're going to get spread of effect. Around here, not a big problem as much, but I don't actually put my neuromodulator with my PRP or PRF. I would do it as two separate things. You can do it on the same visit, but I have seen if you don't want it to spread, like you're doing your injection here, let's say your lateral corrugator where you want to avoid a brow or more importantly a lid droop, levator palpebral muscle. I have seen when you add PRF and PRP, the spread of effect become a problem. And why is because I often do plasma sculptor and PRF mixed together, and I'll do it up through the temple, and I'll do my neuromodulator at the same time. So it's just be mindful of the spread of effect issue that can occur.
we had a few other questions scrolling up that they came in too quickly. One was, how would you do a lip flip with the small lip size without having a ducky look? And then another one was, is there a way to lift brows by making the forehead firmer?
Yeah, those are the great questions, and right in my wheelhouse because I like those. So let's go to the lip flip first. When as an injector, what's your and I did a video on different techniques of lip filler. You know, you have the Russian tenting technique. That video's taken off because people, what's the Russian technique? They want a new technique. And I've been to Russia, and so I see the techniques, but what you see with all these different techniques, the pillar technique, the traditional wet-dry border, the vermilion border, to get a good lip flip, an injector's always looking at what's occurring with that person's lip. We can look and we can guesstimate, okay, the vermilion border is perfect, the projection's perfect. This is a person at risk of a duck lip if the chin is retracted, if the piriform aperture is forward anyway. Yeah, so we look at that, but the two main methods would be obviously old school filling. I call it old school because all of these techniques were done 20 years ago with collagen too, but people would consider it new school to do the injection technique from above with those little pillars or the tenting technique. That's one way to do it. The GK point where the philtrum column meets the vermilion border is so important to get that flip, and you could put a little bolus, being mindful of the columellar artery from the superior labial, but you can put a little bolus in there. You're superficial, which makes it safer. And then here's the thing: if you're looking at that lip and going, "Oh, I want a vermilion border," but they're flipped already, but you want a crisp area where no filler can migrate or anything, PDO threads are wonderful for that application.
We had that at ICAD.
Yeah.
Yeah, the session, very, very interesting.
Right, and because what you're doing is you're putting a thread of product right at the border. It's where you want, it's precise. You don't have to worry about the G prime of the filler and can it flow or is it too soft, and it doesn't attract water. Water's your enemy over time with a lip flip because you're going to look boggy, and it does the opposite. 1228 Wellness. See, there's some Americans on here from Florida and everywhere. It's good, and we have Seattle skin. Yeah, good. Okay, so that's the lip flip, and don't discount PDO. Why PDO threads get kind of a bad name in the lip, if you would say, because people think, oh, we're putting them in the body of the lip. If you want to do it and you like that, there's nothing wrong with it. But to me, it's not the exact, for me, use of I'd use filler, I use PRF in the lip before I would do that. But at the vermilion border, the collagen 20 years ago we used didn't draw water in, and it gave the best border in the world. We don't have it now, but threads are good.
Okay.
And the brow, you ask about the brow up here.
Yeah.
And that's where the person asking about radio frequency, the forehead's so important to people, but when we neuromodulate the above here, which is the frontalis, the only one thing that can ever happen, and people believe that you get lift here, but you don't, you get droop. Injectors know you get droop, but our patients think that if we inject here, we get lift. We don't. So what do we lose? We lose fat, okay, and bone, but people want to recreate fat. So everyone asks me, can I do sculpt or plasma sculpt in the forehead? I do it, but I don't like it. I don't like to do it. I think it's a little, the risk, I do it when I'm pushed to, or if I had patients take risks. If we tell them, hey, if we inject a nose, I don't like to do it. I do it. I try and do everything else. But if a patient wants a nose injected and they understand the risks, and I'll do it.
Yeah.
And I'll do it as safely as I can. But so foreheads are people, and males, and especially Asians who've had different things put in. They're very comfortable treating the forehead with things. And their risk tolerance is different than maybe an American. And I do it. But what I do like to do, what I'll do regularly, is PDO threads. Smooth threads we talk about jacking up the cat eye.
Yeah.
But smooth threads up here, to me, again, like the lip border, it's built for that. Doesn't draw water in.
Very subtle.
Again, subtle. It works over time. It doesn't droop. And it builds collagen long term, so you don't have to do it that much.
Okay.
So the forehead is perfect for smooth threads.
Thank you very much.
I like those. Yeah.
One of our other questions is what's best for the jowl area, and I feel like this is where threads will come in again. So we'll or anything, whatever you're thinking.
I think you're right, and everyone always goes to threads too because we think of lifting.
I'll biggest thing. See you in 10 years for mine. Yeah.
Anytime you want, and hopefully I see you before 10 years.
Oh yeah, you definitely will.
Yeah, I'll keep consulting every year. Don't you worry. We'll keep talking. But yes, for sure, a lot of people think of threads. But I think the number one thing we see as practitioners is people come in and say, "Here's my problem," and they'll look, and I'll say, "Here's your problem." Because where did this come from? Well, it's not just a droop, but it plays a role. Hypertrophy of fat, loss of bone, muscle. So it's complex. But the patient, to me, in my practice, I'm always going to treat the whole face.
Yeah.
I don't spot treat per se anymore. If clinics are starting out or your patients aren't used to hearing you say, well, you need a full face done, and they have a jowl, you can start here, but just make sure they know the first thing to do is treat the upper face to make them look normal and move down. But yes, PDO threads, filler, the gonial notch here, or the gonial angle is so important. And one thing I've been doing that I like a lot is just bolus of Sculptra right on the bone, high dose. And so it really does recreate, in a sense, the bone, and you get the collagen stimulation of the tissue tightening. But jowls are a combination. Unfortunately, for most people, it's going to be threads, fillers, and Sculptra in my practice. All three.
All three. Okay. It's similar in the UK. You know, the whole movement of having combination treatments is really, really taking off. I think people realize that when you just go in for, like, you know, one syringe of filler to do something, it just doesn't really have the effect that maybe people are imagining as a consumer and everything. So.
And
that's before, it works in harmony.
Maddie, that's my generation's and my fault. I have to take full responsibility because when in the days of collagen in 2000, we would sell a syringe. That's how we were told. That's what we did, and really we didn't have the tools. Sculptra wasn't aesthetic. Sculptra was approved in 2009 in America. In Europe, it was 1998 for HIV lipoatrophy. They'd bring their Sculptra from Europe and bring it to the United States, say, here, inject me, because we didn't have it. So we didn't have the tools. And also, companies really can't teach combinations because it's not FDA approved. Most people are used to getting trained for free. The company comes in and train them. That's how it was for me until I would say 2010. And then trainings, all the great things you guys do. We can talk about combinations. We can have those. How about those discussions we have at the conference, right?
Yeah, they're so important because
I mean,
it's the only time where you do get really good combination treatment training where they'll use, filler in multiple parts of the face and threads at the same time. And yeah.
And we can talk freely. I mean, I remember in the last one we were at, and someone didn't show up for their talk. Someone got late. I got up. We just started talking from stage, and we had 1,000 people out there. We were just having a conversation about the under eye.
Yeah.
You can't have that with a company. You can't learn that from a company. And as much as
the products.
Yeah, as much as I'm an educator or teacher, I'm really just a facilitator of taking information from all the people that are watching here and all the people that watch, and we bring it together in a forum and talk. But companies can't do that because it's a change. It's a G-Face High. We have the East Coast here. All these great people coming on here from America and the UK. You see right here, we're learning about around the world just from this platform. Yeah. So I thought we've had great discussions over there.
No, me too. And you always learn something new as well. So
yeah.
And I love how many comments we've had over this, all of the questions. People have got really involved.
Well, I think
I've learned a lot. So
yeah, and I think the interesting thing too, from a lot that we do in around the world with these conferences, is finding out. And Sweden, look, we got Sweden here. Sweden, they need to teach us about how to deal with the world. Sweden does right now. I want to go over there windsurfing. It's a little cold, but I want to go to Sweden and hit the ocean there. Beautiful. But and just there, when we get to a conference, we're going to learn a lot from the Swedes, who are going to tell us how they're dealing and how they've dealt with it. And so the conferences are so important that way, but you can see these learning platforms are pretty amazing. But I thought it was interesting finding out, particularly in Asia this last time, a lot of the number one concerns of our patients here in North America were very similar, different angles and different twists. But like, for instance, what's your concern? My under eye. Okay, well, that's the same thing driving America. My jawline. I mean, these Asians over there, they all had perfect jawlines, but we were doing jawlines, right? I'm like, wow, it's perfect. I want it more perfect, doctor. So, like it transcends the world, which is interesting.
Yeah. I think, it is fascinating learning about the way that different doctors will treat in different countries too. So at ICAD, they would have sessions on like treating the Asian face, the structure is different and everything like that, versus treating a Caucasian face. And then obviously there are different beauty ideals that come into play with that too. So
I learned so much that way from the patients. I just and even if you take a lot of the Asian people, they sit there, they don't say a word. You can do. They don't want anesthetic. They're like, you do whatever you want, doc. Very different psyche from the American patient's going to walk in and they're going to say, I want 2 units here. I want half a unit over here. I want 2 here, this here, and I want to spay. I'll have it all for $300 because the guy down the road will. Very, very different mentality of the patients, and it really, I think, going to the conferences and you guys do a good job of it. You learn those concepts, and we bring it back to our own practice, and it helps change the psyche of how our patients think for positive direction. Yeah. Do you have updates on any conferences for me? I got to get out of the house. I'm ready to come back and work with you guys. What's going on?
We can't wait for everything to get back on the road. Obviously, like we did have to postpone everything just for the health and safety of everyone involved. So next up is FACE, which will be the 17th and the 18th of October in London. And then AMWC is the 4th, 5th and 6th of November in Monaco as per. So we're very, very excited. Just to have everyone together again, and because these conferences are brilliant for just sharing ideas and innovating and learning and just connecting. So we think they're very, very important, and we can't wait to welcome everyone back too.
Yeah, well, I know a lot has gone on online. I know a lot of conferences going online, but to me, there's something about being face to face and side by side and having a conversation. and
You
sharing
can't beat
ideas.
it.
You know, it's one of those things that you cannot. And just when people are communicating and talking, just what they're telling you with their eyes and with their and being able to sit down and have a conversation, it's different from a Zoom, it's different from everything else, and the one-on-ones, and being able to, how many people take you aside and say, hey, what about this one? And then just taking pictures and camaraderie. And
Yeah.
you go back to your practice, everyone goes back and they're excited. Can't wait to go back to work. I can't wait to do what I've learned. It's just different online. I just, so I'm excited
As
too.
lovely as this is, yeah, I have to agree
Yeah,
with you.
yeah,
I have a question, and I think the
yes,
audience will love this too. Is there a favorite procedure that you have that you do?
by far. I mean, so I look at, and we all have our own favorites. And
Mm.
what a favorite is to an aesthetic injector is you go into your clinic and you go, if I could do this all day long, I'm in nirvana. I'm in
Yeah.
heaven. And that's how I look at it. And for me, it's having a patient come in, it's doing a 3D image, taking 3D pictures. It takes 2 minutes now, putting it up on the TV, looking at their face, discussing the aging, having them understand what's going on, and then I do what I call plasma sculpt. It's
Okay.
nothing. I own it. It's a trademark
I
procedure.
look
It's
at it.
nothing.
Yeah.
Yeah, it's nothing I try and sell or tell people to do. It's my own thing for me. I have no interest in it other than that. But and reason it's one thing. Someone asked about thermogenol therapy, and those they're sold as one thing. I use the word selling lightly, but and this is one thing. And what does it involve? It's sculptor and platelet-rich fibrin. They can add on neuromodulator, different things, but if I can do this, I know I can take them to another level. And it's sculptor and platelet-rich fibrin, temple, PRF through here for hair growth, PRF under the eye for what it does, sculptor and PRF here through the cheek, preauricular, jawline, chin and lower face, especially females 40 plus, where the skin's going to get loose,
Yeah.
nasal fold if they need a little bit, and it's the whole thing. And it's 2 sessions. So I see them back at 6 to 8 weeks. And
Okay.
if I can do that for a person, I know at about 4 to 6 months, they're wowed. So, and I love doing those injections. So
Lovely
for
seeing
me,
before and after as well, you know?
yeah, oh yeah, I mean,
So
and
satisfying.
what I love about it is you do your before and afters, have before and afters. I never have to, I mean, probably 1% of the time do I ever have to show them the after, because it kicks in over months. But what the people there around, their family or the colleagues, you look good. What is it? Your skin looks better. You're glowing,
I
and
glow.
no one can tell what it is.
Yeah.
It's not lip filler where they go home tomorrow and they see it today, the next. And why I like it is I can tell people about the aging face and they understand it. A lip filler is it's easy to me. You go in, you want a little lip filler, great. You see it, they're happy. They get one syringe. You can actually see the result. With something like plasma sculpt, the education goes in that, hey, we're building your collagen. We're going to give you glow. We're going to pick up here, but no one's ever even going to know what you had done.
Yeah. Not
And
felt
certainly I'm adding lip fillers to it. I'm adding neuromodulators, lasers. You can add it all to it. But my go-to is just getting that collagen building in there and having them understand that this occurs over months, not the wham, bam, wow, wow, you see it in 2 seconds. It
sometimes that's hard
switches.
to explain to patients, you know, that it will take some time, because often I think we have a culture of expecting the immediate results with things like fillers when,
Yeah.
you know, some other procedures, it's not like this. You do have to wait a few weeks for everything to kick in. But
And
obviously,
I'd say here's a take home for me to everyone watching and everyone with clinics. And this is just a thought. I'll throw, Rajani thoughts. That's all I do. I just throw random thoughts. But here's what in teaching, I'm doing private. A lot of people are doing private trainings right now because of what's going on. I'm going into clinics and we do privates. And this is where I learn a lot, and I can have a one-on-one with the injector. And here's a conversation we had last week. And this is what I've done for my practice. Say, hey, what is it that I want? And I just told you I want to do plasma sculpt. That's what makes me happy. I like all the other things, but I fill lips for 20 years. So what is it that they want in their practice? I know that if you come see me, let's say you didn't know me and your friend, and you said to your friend, hey, your friend said, you look good. And they said, well, I saw Rajani had this done, and you come see me. Okay, great. You're already your mindset from your friend
Yeah.
is that my friend looked good over time. She kind of said, just do what Rajani does because he'll just take care of you. Da, da, da. So you got that little bit of trust. I don't have to start from square one with you. You're obviously different, and everything you need is going to be different than your friend. But this is the fun part of looking at.
Yep.
And the people that come to me already know what I do. So it makes my life easy, my practice easy, and the expectations easy. So if you're a lip filler clinic and that's what you could do only that for a living, you know what your Instagram is going to look like, your patients know what to expect, and it's going to be a vibrant, great practice. And if you want to do the kind of things I do, the more energy you put for what you want, that's what you're going to get. And if you want to do everything and lasers and everything, so you can develop the practice you want. And that's kind of my message is, it is hard to explain that to patients. It takes time. But as you develop that practice, it isn't hard because what's coming to you is those people who want that.
Yeah,
so
that's true.
Stick with your niche is, I guess, the message, and whatever floats your boat that you want to do, if you do right by the patients and you can be somewhat predictable in your results, you're going to. Aesthetics is growing beyond anything. It's growing as fast as computer chips. You know, put your money in DRAM and lip filler, and you're going to be fine.
Yeah, you'll be set. That's very, very true. That's very, very true.
But your point's well taken. When you're doing stuff like that, part of my whole thing in my mind was, how do I overcome that patient perception that things take a while? And I wanted to be successful at it. So part of the 3D imaging, the picture taking, and the conversation, I enjoy that part.
Yeah, and I think just explaining things thoroughly is so important. But I mean, and it's normal to get slightly impatient. It's like if I've started a retinoid and I have to wait, 6 weeks for anything to come of it. But
it's true.
Take time.
And that's why we have like Botox-like products, Botox Dysport, all those, because you can give them that quick hit. And then the rest of it's going to kick in over time. But we have that ability. Aesthetics is a unique field in that it's all encompassing. Some people come in, all they care about is their brown spots. It's okay. You can educate them on everything else. But if that's all they want, we have something for them. If it's only their lips, we can educate them, but they fit into what we do. If it's their full face, they fit. So for practitioners in this field, it's just an amazing time. I just think it's a time like no other. Sit back and enjoy that you're here, And for patients, I mean,
and people are becoming more creative. You have the ability to try and experiment a bit more, which is what we discussed earlier, which is super exciting.
And I think you see, especially from your conferences, that people that are sharing good best practices, we have a good crew of people who are doing this. And I see that, it weeds out those, like you said, the flash deals, and they kind of weed themselves out. And I think that's been a nice part of, because in 2004, what drove people to practices wasn't fillers. We didn't have it was hair removal, laser hair removal. And that lent itself to flash sales and price wars, just like tooth cleaning, dental whitening. You know how that started at $1,000, or eye surgery for vision. Remember, eye surgery was $3,000 for a laser vision. Now it's $199.
Yeah.
But when it comes to aesthetics, a lot of it is in the eye and the education of your provider.
That's true.
It's not so. For the people who truly want to look good, natural, it's not that commoditizable. Would commoditizable fit with the English? I grew up in Canada, so I have the Queen's English.
Yes, no, that works. That definitely does work.
Commoditizable.
When it comes to your face, this is what people see first. You have to make sure that you really trust the person who is going to work on it. I mean, fair enough, some fillers can be dissolved and everything, but not everything is completely reversible. So it's just quality over quantity too.
Yes, very, very true. So we're blessed to be in the industry and blessed to have all these, all the tools.
Yeah. Exactly. Should we have a quick look over some questions, and then we've been on here for 50 minutes.
They're going to cut us at 60 minutes. At 60 minutes, they cut you. So just PLLA threads. PLLA threads are good. They're among the longest lasting. We have India on here. Kybella for the jowls. I do like it. I like PLLA threads. PCL, polycaprolactone, and PDO, polydioxanone, and then PLLA. Those are the three main types of threads, other than the permanent threads, which we don't see a lot of anymore. But yes, I do like PLLA. I find them a little slippery at times, so they have to be made well. And then, yes, you just have to be a little bit cautious if you're using Kybella here about dinging the nerve, because the nerve affects the smile, but it always comes back. And Dr. Stankovic, hello, another lecture that we had over there.
Yeah, oh my God.
Yep. And so, yes, I do like Kybella there. The risk of vascular occlusion with PRF, just treat it like a filler and you'll be fine. There's no known PRF occlusion that I've ever heard of, seen, or read in the literature. What produces more volume? What about PCL? What produces more volume is the larger thread with a larger number. Just be mindful in a place like the nose, when you get to over 10, 18 to 20 gauge threads, that's about your stopping point. You don't want to overstimulate collagen, but it's the larger thread. PDO would be the shortest acting, followed by then PCL and PLLA are right in there for the next longest too. But in terms of volume, if you're truly looking for volume, do something like PRF, Sculptra. Facial volume with fillers, it's just too expensive. You have to dilute them down. There's lines of demarcation. So if you want volume on a zygomatic bone, sure, add fillers. Volume on a jawline. But if you want full facial volume, you need something with a carrier like water. You can get polydioxanone liquid. And so that would be like a biostimulator, or like a Radius would be a biostimulator for volume. Can PRF add volume to the nasal folds? Sure. Yes. I think what we're doing, and this, I don't have a study on this, I think we're plumping fat. And I think that's what we're doing under the eye. We're making the skin healthier, the fat a little healthier. How do you feel about ultracell like Ultherapy? Again, I love skin tightening, but it's user dependent. PCL and PLLA, a lot of questions on threads, you see. Everyone likes it. Everyone likes the threads.
In last minute now.
I know, right? They feel comfortable with us. They were shy. And you can watch a lot of the, if you want to see differences on PCL, PLLA, you know, there's a lot of YouTube videos on it. You can ask me there. Come to the conferences and we can talk in person, of course. So, yeah, right? I mean, the conference is the best place because it's like a round table.
Yeah.
And we had a great, we do, there's good thread break-offs in the conferences, right? I mean, yeah. Dr. Siad and I, we had one that was good too. So yeah, volume, I would add that. And yes, you can add PRF and threads at the same time. You just don't want to, if you're doing barb or lifting threads, do too much PRF around the thread, and you don't want to dislodge once you put a barb in. If you're mucking around there with your cannula, you don't want to loosen the thread. But the good news is a lot of places where you're doing PRF are going to be removed from your thread vectors. Maybe I'll do a video on thread vectors. It's something I haven't done too much on.
Oh, I do actually. I think people would love that.
Right, and I have a little model head here. I'll make it up and put, because a lot of people have the questions on vectors.
Yeah.
Skin
they're coming
pen.
in faster than you can answer.
Pardon me?
I said they're coming in faster than you can answer.
I know. I can. It's like it's like hot hour or hot minute where you're just answering questions. Boom, boom, boom. Both increase collagen and elastin. Yeah. Interesting on collagen is MMPs. MMPs and collagenases that eat up our collagen. We basically don't make as much collagen over time, and we break more down, and you get into that cycle. So anything you can do to boost up your collagen production, like threads, like radiofrequency. A lot of questions on microneedling here too. Microneedling, radiofrequency, I love it. We're doing a study on one device in my clinic now, and in general, yes, I like it. Again, depth and the amount of energy is going to be important to the result. And acne scars is wonderful for it, true. And you can do a lot of these at one point at the same time, at the same day, which is what I like, because you don't have to go so deep with your microneedling radiofrequency as where your threads are. And everyone asks if it's going to melt, and understand you can dislodge, you can move, you can suction, but you're not going to melt the PDO threads at 43 degrees, which is where you're at with your devices. But if you inject and then you heat, now you're around the same tissue. You're not going to melt the thread, but it isn't what you want to do, because the inflammatory process, you're changing the nature of it. And in medicine, we like one thing at a time, so we can determine cause and effect, essentially. Secret RF is nice. I like it. Yes, I'm a fan. And I do like it. And I think a lot of the microneedling RFs that are tunable are good. It's not just one. There is a second generation now that I think are a little bit better, and they have insulated pins. But if people know how to use it, it's almost more important than the device itself. I have old devices I like, but I know how to use them and I like them.
Make sure there's no operator error then.
Yeah, operator error is the number one. Because if you give me a name of something like a violet, I'm just making up a name. I'm going to get a violet procedure. It's me doing it that day is going to make way more of a difference than whether it's a violet or a tulip or whatever else. It's, you know, I don't want to use a brand name just to, because I can do it wonderfully, or I could do it not thoughtfully, and you're in trouble. Insertion point for PDO threads. I'll do a video on all different vectors. But how frequent are scars from the insertion site? Should be almost never. You're using an 18 gauge needle at biggest, and when you use that, that's going to heal up fine. Bury your thread. And I just did a video last week on burying the thread. I'm seeing a lot of people not burying the thread, and then you get a point of insertion, it gets inflamed, and that could scar. So burying the thread is an under talked about issue, and in trainings we see it all the time, and that means getting the scissors, pushing it down, and moving the thread deep. Because we're using big threads now, so you have to make sure that end is deep, because it will come through and it will cause inflammation. So that was a really good point. Sculptura, and here's a great question. This is classic. Sculptura or RF for the chest wrinkles? Everything. It's both. If you're in Arizona, if you're in Southern Florida, Southern California, this area is hammered. The skin is thick, it's leathery. You need laser, you need browns, you need peels. If you're in Canada, you might just get by because they're not getting the sun exposure here. You might try one and then go to the other. But remember, radiofrequency and Sculptura work together. That's a great marriage. It's one of my favorites. So you say, what would I do after plasma Sculptura resurface? Injectable, superficial injectable radiofrequency. You don't need to go deep, because if you've had Sculptura, that's structural. So there you go. So that's a lot of great questions.
So many.
I'm just ripping off answers. I'm not even letting you talk. I'm just hitting it.
No. You are the star of the show here. Thank you so much for allowing us to pick your brains, and just you sharing all of your knowledge has been brilliant. I love how engaging this has been. I don't think I've seen an Insta Live with this many questions, just like hot off, each one off. Well,
it's a challenge for me. They're like, does Rajani know this? Would you? And I like it, because I should know. Yeah. I should know everything, right? That's my job. And if I don't know everything, but everything within the realm of what I do, this is what I study all the time. So it keeps me. And if I see something I don't know, I'll go find out. You know, I like it. It's motivational for me to, if you're not on the top of the game, you shouldn't be in the game. But am always learning, and so it helps me. It helps me see how people are thinking. So, and that's why I just can't wait to have a bite to eat with you again at the next conference. It's going to be great for me to sit down with people and interact.
Must do. I really, really can't wait. So.
And I appreciate your guys' kindness to me, always welcoming me and taking care of me and inviting me, and it's an honor for me for you guys to think of me and invite me here.
I have to say, every single time you host a talk at one of our shows, everyone loves you. You get the crowd so engaged. You're so uplifting, and this is why we've had so many people on the live. You know, you're one of the best speakers, so can't thank you enough. I'm going to